Thank you, Malin, and good morning, everyone. Great to see you, bright and early this morning. So welcome to SciLife Lab, and as Malin said, I'm Vice Head of Operations here. And I'll give a brief introduction of SciLife Lab and where you are today before I'll hand over to my colleagues Päivi and Janne, who will then describe our efforts within the precision medicine scope. So SciLife Lab was founded in 2010 by the three Stockholm universities, KI, KTH, Stockholm University, together then with Uppsala University, which is located just a bit north from here. And a few years later, SciLife Lab was appointed by the government to serve as a national research infrastructure in life sciences. And today, SciLife Lab is present at all major universities, present locally also where the university hospitals are located and where the precision medicine centers are set up. And today we are here at SciLife Lab campus Solna, which is still SciLife Lab's biggest site, and the only one where we have three universities co-localized in the same building, together then with the national research infrastructure under the same roof. And of course, the location is a fruitful one, also considering the very close vicinity to the Karolinska University Hospital and the Karolinska Institute that you visited yesterday, as well then as the big science park and on all the large and small companies in the area. So SciLife Lab is active in several areas. The research infrastructure is a core function, and I'll say a few words about that. But also the closely connected research community forms the basis for the working model, where the needs from the cutting-edge research pushes the technology development that in turn then allows for cutting-edge research to be done. And the field of life science in general is getting increasingly data-driven, and SciLife Lab hosts a large 3.1 billion Swedish krona, which I guess is about 270 million euros, a program, a 12-year program funded by the Wallenberg Foundation in data-driven life science, the DDLS program. SciLife Lab also provides a lot of advanced training through several junior faculty programs, as well as PhD and postdoc training. And much of what we do through collaborations with different stakeholders is for the benefit of society, and this will be discussed more than by Päivi and Janne in the next presentations. So the aim of SciLife Lab, when it was set up as a national research infrastructure in life science, is really to provide the prerequisites for research that would otherwise not be possible in Sweden. Since the technological development is so fast and expensive that it doesn't make sense for a single research group or a single university to set this up in-house. And the technologies here are really then provided to serve the entire field of life science, from small molecules to entire ecosystems, and from human health also to environment. In SciLife Lab, we sort of view the whole spectra as life science. A couple of words about the infrastructure and the services provided. Today we are organized in 10 platforms with about 40 units spread over Sweden. And the Nobel symbol here alludes to the fact that these technologies were available at SciLife Lab as services prior to them receiving the Nobel Prize, which is in line with the aim of providing cutting-edge research infrastructure. Also, many of the technologies were developed largely at SciLife Lab, such as the spatial transcriptomics, for example. And I'll round up with a few numbers. These are some of these figures are from 2022, so a couple of years old. But in 2022, we had 3,700 projects served by the infrastructure, and some 1,800 individual users. The vast majority of the users come from academia, but we also have users from other sectors, such as healthcare and industry. And in 2022, there were some 100 international users of the infrastructure. And the infrastructure, the platforms at SciLife Lab generate a lot of data, as seen by the 10 petabytes, which is a figure hard to grasp. And the academic users of the infrastructure, over half of them come from universities outside the founding 4 universities, which of course is important for a national research infrastructure. The industry and healthcare users, it's more than 100 unique companies that use SciLife Lab yearly. And a lot of clinical patient samples are analyzed at SciLife Lab. So this again is a figure from 2022 with 68,000 clinical samples analyzed at the clinical genomics platforms of SciLife Lab. And then the infrastructure staff is really a core function of the infrastructure. The expensive technologies is one part, but to have the experts running these. A lot of the staff has PhDs. And one slide about the funding. This is the base funding to SciLife Lab in 2024. So from government, it's 550 million Swedish krona. And then the DDLS program funded by the Wallenberg Foundation is another 320 million. But this this funding is excluding then the user fees as well as other funding to the platforms. And I'll end here and give over to Päivi. But I'll end with this slide that's frequently used by our new director, Jan Ellenberg, who has taken over as director this summer. He comes from EMBL in Heidelberg. And really underlining the exciting times that we are living currently in life sciences, both with the technological and the data revolution, that are providing new tools that are really changing the fields, in that the generated vast amount of quantitative molecular data is really driving the research, and using AI and other tools, we will be able to predict what is really happening in living systems in a way that has not been possible before. So with that, you got sort of the overarching view of SciLife Lab, and now I'll give over to Päivi, who will take you more in depth into the efforts in precision medicine. Thanks.